Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Matt Hornbeck, principal of Hampstead Hill Elementary Middle School in Baltimore City, about the challenge of education in the midst of the coronavirus pandemic. Principal Hornbeck provides nightly updates for parents, has raised thousands of dollars for grocery gift cards, and relies on teachers and other staff who themselves are home with multiple children. Let's listen. Principal Hornbeck, thank you so much for joining me. Can you tell us a little bit about Hampstead Hill Academy?
Sure. Thank you, Dr. Sharfstein. Hampstead Hill Academy is a pre-K through 8th grade school in Southeast Baltimore City, serving 859 students in grades pre-K through 8. We are demographically about 40% Hispanic, 40% white, 20% African American, and we have about a 65% free lunch student population and about 100 staff members supporting and providing for those students and their families.
Now, I know I've read about your school in the paper because you've gotten some academic awards. Is that right?
We have. We're the number one performing school in the city for the second year in a row, and that's due to a lot of great work. But I have to be honest that there's great work happening in every school all over the city, and we're excited to be a part of that.
And you've been at Hampstead Hill for how long?
I'm finishing my 17th year.
Wow.
And it's really been my life's work, and it's a great blend of policy and practice.
So in those 17 years, you haven't seen anything like the coronavirus pandemic?
No, gosh, I mean, this is the word everyone's using is unprecedented, but it's just a mess. It's a mess for teachers and students. It's a mess for parents. It's just from instruction to trauma to how we're going to move on. Everybody's just really working hard to figure it out, but it's been a very difficult 6 weeks.
So let's take me back to the beginning. What happened on that first day?
So Thursday, March 12th, the night that the governor issued a shelter-in-place order, we found out the same time everyone else did, and we were in school the next day, and in a sort of panicked way, got as many learning packets out to kids as we could, and then spent the first few weeks getting Chromebooks distributed and figuring out safe protocols on how to do that. And our staff really stepped up, and we put together a hardest to reach list so that we could.
What's a hardest to reach list?
The hardest to reach list is the kids that haven't connected, that we haven't been in touch with. And we've whittled that down at this stage to about 55 of our 859 kids. And we just haven't heard from them. We don't know where they are. We don't know what they're doing. And
what do you do to find them?
So we're comparing phone numbers that we've had. We're trying to figure out if any of their siblings are connected, even if they were former HHA students and are now in high school. We're talking to the various staff at school who might have interacted with them, and we're doing a pretty good job on that, but very difficult. And if I may, there are three things that are prerequisites for online learning, and one is having a device. A laptop or a tablet, and two is having a Wi-Fi connection, which can be very challenging in Baltimore City. And then three is having a parent, an advocate, someone who can help you figure it out, and that's tough.
So on a regular day, the kids are in school, they're right with one teacher, they go to another room, they got another teacher. What does it look like now for them in your school now that they're home? And let's say they do have a laptop and an internet connection.
So it doesn't look anything like school used to look. I mean, it's hard to even call this school. We're doing instructional videos. We're doing coach class. Kids can log on in a live setting and ask questions of their teacher. We're doing some social emotional online Zoom calls with middle school students and elementary school students. But it's really, we have provided sample schedules to parents, but there's a lot that is left to the parent and to the household. And people have lost their jobs and struggled even before this pandemic. And now it's just really exacerbated and magnified all the challenges that the schools face.
So you're kind of counting on the parents to do the lessons and submit the work for the kids. It's not like the kids are going from 9 to 10 to one Zoom class and 10 to 11 to another Zoom class. Is that right?
Correct. I mean, if you can imagine 25 kids in a class, they can't all show up live with the teacher at 8 and then just go to their next class. That's just, I mean, I don't know of any school that's doing that and doing it with large numbers of kids successfully. It's more about recording lessons and then turning in assignments. And some of the older kids can do that in a more independent fashion. But as you can imagine, the 5 and 6 year olds really require a lot of support.
Yeah.
So,
It must be really hard for the kids because I'm sure they come to love their teachers and it's sort
oh,
of midway through the year and now they don't have them. I mean, what's that
well,
like?
all of us remember, a teacher from elementary school, and kind of these teachers are larger than life figures in the lives of these children, from a social emotional perspective, from a I want my teacher to be proud of me perspective, and they to have that ripped away so suddenly, and that structure, not only their friendships with the peers and their classmates, but the teacher has 7 hours a day with students, and it's been very, very difficult. It's difficult on teachers as well. They're struggling to. I mean, the work and what they signed up for is nothing like what this is. They're not with their students physically, so it's very tough.
Do you find yourself having to counsel the teachers? They must feel a sense of loss.
Oh yeah, I mean, we're a restorative practices school, and so we're doing a lot of self care and self reflection work, and they are struggling just like everyone.
Tell me about the social needs of the parents. You said some of them were losing their jobs. How does that affect your new job as the principal of a school with no students in it?
So I think that the parents are, in many cases, are struggling because they've lost jobs. Childcare is not available except for essential workers. So if you do work and you have a 3 year old, a 5 year old, and an 8 year old, it's very difficult to stay on a schedule and to get the work done. And they're worried about the future, and they're worried about whether the kids will learn everything they need to learn to be successful in the next grade. And then the kids in 8th grade are worried about, is high school going to start? I'm sure the kids in 12th grade are worried about, is college going to start, or is my job going to start? No one knows right now. I mean, everyone's taking their lead from the healthcare professionals, but it's been very difficult on parents. I have a weekly call with parents, what we call Chat with Matt, and between 50 and 90 parents get on a Zoom call with me, and we just talk. And
What do they ask?
they
What's on their
they're
mind?
yeah, they're everything from what is how are we going to look at grading to promotion, and then we're doing announcements on food distribution, and how people can give to our own efforts at fundraising around food and technology needs that our families have. I guess the number one question is, how can my kid connect with his or her teacher in any fashion like they used to at school? I think their sense of loss is sinking in, and they see their kids, inside for much of the day, and not with their friends, and not able to engage with the teacher. And so it's been very difficult. And we're doing things like, teachers are recording videos of themselves reading children's books, and we're doing various social emotional Zoom experiences where we can do some mindfulness practices, circle like questions online, and then some truly instructional opportunities where kids can dial in to ask questions about the lessons themselves.
Well, I mean, I can really sense the frustration in your voice.
Mm, yeah, it's as I said, we're trying to play the long game so that in 18 months, when we're back and hopefully settled, we're going to be able to begin to understand what we've all been through. Because I think that there's trauma on so many levels for staff and students and families that is not, you go back and forth between feeling things are normal. I mean, before the call, you and I were saying that the weekends can feel slightly normal, and they're just not. Like as we said, it's just not nothing's normal right now, and it is a weight that adults feel and a weight that then kids feel.
Well, you've got to also feel that the work that you've done for so many years and the relationships that your staff has with the students is going to be a source of support for them to help them get through this.
It does. Our school community is very tight knit, and we do have an extraordinary staff. And there is a so-called distributed leadership model we have at school where there are lots and lots of leaders. And so I'm really proud to be part of that community and proud to be. I grew up in Baltimore, and Baltimore schools are doing great work all over the place. So it's a good thing to be able to contribute and help, but it's an awful thing to experience and to go through.
Well, I really appreciate your joining me. If somebody who's listening wanted to contribute to your efforts, is there a way for them to do that?
Yes, thanks so much. If you go to www.hha47.org, there's a donate button on our website, and it'll walk you through it. And 100% of the donation goes to food for Baltimore City students. So thanks so much, Josh. I really appreciate it.
Well, thanks for spending some time today with me, Matt. Take care. Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.